In this video, we're going to talk about which sports tape you should use to help with your knee pain. Hey runners, my name is Alina Kennedy. I'm a physiotherapist and strength and conditioning specialist with SprintRehab.com. When we're talking about sports tape, we've got two main options. We've got kinesiology tape and we've got this classic rigid sports tape. They are both very different structurally and they serve very different purposes. So let's talk about when you would use either tape. So firstly, this brown rigid tape. So this tape is, as the name suggests, very rigid. It is very strong tape. It does not have any elasticity to it. It is going to stay absolutely put once you put it down onto the skin. So we use this tape for injuries that require stability. So whenever we have a weak joint, anyone that is recovering from a sprain, this tape works really well. If we want to manipulate where the joint is sitting or how it moves, this tape works really well. One of the most common injuries that I use rigid tape for runners is swelling around the kneecap and pain underneath the kneecap. And the reason is that we can manipulate where the kneecap is sitting and really shift it into a position that takes away some of that stress and load around the kneecap and relieves that swelling and pain around the kneecap. So we can put it down in a way that shifts the kneecap across by pulling on the tape, because the tape itself isn't going to stretch. So by me pulling on it, we're actually shifting the kneecap across. And we can put a few different strips of this tape down and slowly support the kneecap into a position that is going to relieve pain. So we can move this across and shift the kneecap across. Now, by doing this, we're actually going to take it away from the area that's causing pain and move it into a different position. And this tape is really strong, so as we put more tape down, it's going to feel more and more restrictive. So if you are running with this tape, make sure that you know what it's going to feel like during a run. Don't put this tape on for the first time before a race, because if it doesn't feel comfortable for you, you're going to be in trouble. So try it out, go for a relatively short run with the tape, see how your knee feels before you actually use it during a race. But what I'm doing here is putting it down in a way that is going to give my knee a lot of support. So this is going to feel great if I have pain around my kneecap, because what the tape has essentially done is it's shifted where the stress is going to go on my knee, and it's going to take it away from that area of pain. Now, of course, because it is rigid, it's going to restrict the movement a little bit. I can still move my knee, but I'm definitely going to feel the restriction of the tape, which is why you really want to test out before you actually go out for your long run or your race. So that is the rigid tape. It's also kind of like buying a brace. Personally, I like the rigid tape better because I can be very specific with where I'm applying that support, but the idea is similar. So let's take this off and we'll talk about K-tape. So K-tape, or kinesiology tape, is very different to rigid tape. So unlike rigid tape, this has a lot of stretch to it. So as I peel this off, I can stretch this tape and double the size of it basically. So this tape isn't going to provide that stability and support to a joint, like the rigid tape is. But this tape works really well at supporting muscles and tendons. The elasticity of the tape lifts the skin up slightly and helps to bring some extra circulation to the area, which really helps to facilitate the way that muscle works and prevent some of the fatigue. So rather than using this tape for structural stability, we use this tape for muscle and tendon support. So for example, we would use this tape for IT band syndrome, for quad tightness and quad fatigue, for calf tightness and fatigue, and we place the tape down along the muscle that we want to support. So for example, if we're going to support the quad muscle, we're going to place the tape down around where the muscle starts, and then we're going to apply a slight stretch along that quad muscle. And then place it down. Now, because we have applied that stretch to that area, the tape is going to slightly recoil on itself and lift up that skin. And that is what brings some of this extra blood supply to the area and gives that muscle a bit of extra support under the tape. So again, your rigid tape is going to give you structural stability. Your K-tape is going to give your muscles and tendons a little bit of extra support and facilitate them to work a little bit better. So I hope that has helped you figure out which tape is best for your injury. You can buy both tapes at sports stores, at pharmacies, and even online. And it's pretty easy to tape at home by yourself. There are a ton of videos online, but just make sure that you're picking the right tape for your injury. If you have any questions, please leave them down in the comment section below and I'll be sure to answer you. And thank you again for watching.